So I'm just going to briefly talk about epidemic and endemic infectious diseases and how common they are, and the experiences that we've had with them over the years, and then discuss some of the dividends from global health investments, especially over the last 2 decades. I'll talk about electronic health records in low and middle income countries, or LMICs, and the OpenMRS open source electronic health record. And then I'll talk a bit about evaluation and scale up of these systems, and how they link to other information systems and digital health ecosystems. And finally, I'll kind of bring this together in regard to the responses by people in the OpenMRS community and other organizations to manage COVID-19 and SARS-CoV-2 in low-income countries in particular. So there are many outbreaks every year. This is 2019 from the WHO. You can see there's a whole list of infectious disease outbreaks, some of them relatively small, some quite large scale, but it's an indication here that we're dealing with these all the time. And the experience obviously from SARS and MERS has been incredibly important for many countries in trying to address the COVID-19 outbreak. So one of the key factors here has been building strong public health systems really to manage both acute and chronic infectious diseases. And this investment over particularly the last 20 years has really made a big difference to the management of the more chronic diseases, in particular like HIV, drug-resistant tuberculosis, malaria, but also, of course, the response to Ebola in West Africa in 2015. There's a lot of work also going on for pneumonia and diarrheal diseases in children, where they're the major killers of children in many countries, and also neglected tropical diseases. And many of these lessons include case finding and surveillance, effective clinical care, even in remote areas, really good supply chains, better therapeutics and vaccines, of course, but also the training and decision support tools and other ways of helping to increase the skills of healthcare workers, particularly facing new threats. So I started working in this area about 1999 and started working with Partners in Health in 2000. And the first problem we were dealing with was the growing incidence of drug-resistant tuberculosis worldwide. And one of the striking things about this disease was it was considered untreatable in low-income countries by even some of the leading experts in WHO only 20 years ago. And so some of the people I work with, and I'm very fortunate to work with very committed and brilliant people at Partners in Health, created new treatment strategies along with colleagues in other countries that cut the costs of treatment by about 90%. They focused on use of community healthcare workers rather than expensive hospital setups, expanded laboratories, innovated new ways of doing laboratory testing, and also critically developed global medication pooled ordering so that the high cost of these drugs, which was due to very low supply and low manufacturing levels, could be addressed by ensuring that countries actually work together to order drugs. And that meant having really important innovations in supply chain and forecasting for medications.